Hey you! Is your pregnant wife being annoying about having to throw up every few hours? Can you not stand the thought of creating your world-famous shrimp and jello salad? Well, no fear. With an amazing new wonder drug on the market, your wife can go back to making sandwiches for you and all of your children while being unable to pursue any of her aspirations. Say hello to Thalidomide, an amazing option for every pregnant woman to finally get away from the toilet and back to doing her womanly duties as a housewife, perfect for morning sickness of all kind.
Before thalidomide, I was sad, sick. I couldn't even handle hosting dinner parties without having to excuse myself to the powder room. Now, I'm just sad.
Get yourself some at the local pharmacy today.
Hi, Timmy.
Who are you? Why in my house? Leave! Wait! No!
Welcome to the 1950s. The skirts were puffy, racism was rampant, and medical regulations were more like medical suggestions. Now, come this way. Tell me, Timmy, have you ever been pregnant? Well, along with that beautiful bundle of joy, you get a nice side of morning sickness, back pain, deep cravings for food that would make a grown man weep.
No! Take me home, please.
Good question. I'll direct you to my handy-dandy Housewife 2000.
Morning sickness is nausea and vomiting that can occur at any time of the day during pregnancy. Morning sickness begins during the first month of pregnancy and continues until the 14th to 16th week. Would you like some shrimp jello?
I don't care, just take me home,
You
please.
see, thalidomide was the perfect cure for morning sickness. You could get it over the counter, it was allegedly safe, not addictive, unlike some of the other drugs of the time. It allowed folks to get back to their daily routines. At least, until the babies were born. While many thalidomide babies weren't given a chance at life, those who survived childbirth had severe birth defects. Most were born with shortened limbs, and some had defects in their heart, kidney, genitals, and stomach and intestines. This miracle drug, this panacea, hurt the patients forever. Many of these parents never got to see their kids' first milestones. No first steps, first words, first laughs. But hey, guess what? We still use it sometimes in medicine. It's used for. But let's get down to brass tacks. This is thalidomide. It's pretty small as far as molecules go. That being said, its name is anything but. I'm not even going to try to pronounce it. You can't make me. Now, the thalidomide structure is special. It's a type of compound called an enantiomer. Each enantiomer is a pair of compounds with the exact same chemical formula that can take on two different forms and are mirror images of one another. Now, let's take a look at these two rubber hands, Timmy. At least I think they're rubber hands. Now, like these hands, enantiomers can't look the exact same unless they're mirrored onto each other. They can't be flipped, turned, or otherwise put onto each other. The two forms of thalidomide are called the R isomer and the S isomer. The R isomer is a sedative, and the S isomer is a teratogen, something that causes birth defects. Now, you'd think that the R isomer would be isolated from medicine, right? But thalidomide has this cool effect where in the body, it transforms between the S isomer and the R isomer. But thalidomide does actually have some really cool effects in the body. One of the biggest reasons that we still use it as a medication sometimes is it's something called an effective TNF-alpha inhibitor. TNF-alpha is a type of protein called a cytokine, which are messenger proteins often used by the immune system. It can trigger a series of inflammatory molecules, leading to, you guessed it, inflammation. Now, Timmy, do you like swelling up like a balloon all the time? Yeah, no one does. That's why thalidomide is still used in certain cases, especially for leprosy. That being said, the World Health Organization strongly discourages its use since we have some better alternatives now, like corticosteroids and clofazimine. But thalidomide still has another amazing use. Thalidomide is something called an angiogenesis inhibitor, meaning it stops the growth of blood vessels. This makes it valuable for cancer treatment, especially with tumors. In order to grow in size, tumors, like lovely little parasites, require a constant stream of nutrients, which you can only gain through the blood. In order to continue its growth spree, tumors release chemicals to promote angiogenesis, creating their own network of blood vessels in the process. Thalidomide prevents the new blood vessels from growing, stopping the growth of the tumor. Now, Timmy, shush. Thalidomide is the perfect example of why we need strong medical standards and extensive testing. It can be tempting to want to believe in cure-alls, but without proper testing in a clinical environment over multiple years, we cannot guarantee the safety of what goes into our bodies and what effects it may have. And without further ado, it's been lovely talking to you, and stay safe, kids!